All right. Well, hello, everybody. My name is Brian Hart. I'm the executive director of the Esselstyn Foundation. We are a 501c3 public charity. For those of you who don't know, just a reminder, if anybody's new, we partner with existing nonprofits and organizations and community groups and schools and colleges, universities, hospitals, groups of doctors, and we spread this word about the transformational power of plant-based nutrition and its ability to not only prevent, but also reverse disease. We give all of our programming away for free. So if any of you all are associated with other organizations like churches or synagogues or what have you, please get in touch with us. We'd love to partner with you. Our unofficial motto is if you can get some people on a Zoom call, we will talk about plant-based nutrition with you. Tonight we're incredibly lucky to have a person who's not only a dear friend, but also really kind of leading the charge in many ways on this connection between what you eat and your mood and your mental health. And so Dr. Winings is a doctor of has her doctorate in as a nurse practitioner. She's also an advanced practice RN. She's a board certified as a family mental health psychiatric nurse practitioner. She completed her undergraduate and graduate education at the University of Florida. She has advanced training in plant-based nutrition. She completed her doctoral internship in nutrition and lifestyle at a place called True North Health Center. If you've ever seen movies like What the Health, you've seen True North Health Center. It's in California, where they put people on these juice fasts and help them reverse lifestyle-related diseases.
It's where Dr. Clapper works. They had Dr. Clapper with them.
Michael Clapper and Doug Lyle. Many of you probably know those names who are associated with True North Health Center. She also serves as a an assistant professor at Jacksonville University School of Nursing, where she is leading the charge on transforming nurses' education to really take in this notion of lifestyle medicine, not just for the patients, but also for the nurses themselves, which the Esselstyn Foundation tries to do a lot of work with groups of nurses, because as you probably know, nurses, even though they are out there on the front lines of our healthcare organizations, they actually aren't a very healthy population. And in many cases, statistics suggest that the health of nurses is actually below that of the general population, just because of how stressful their jobs are. So Dr. Winings is coming with a wealth of knowledge about this. And so I'm really excited to hear about mind, mood, and food and the connection. Take it away, Dr. Winings. Thank you.
Thank you, Brian and Esselstyn Foundation and Jane and all of you for being here. This is really exciting. I think this is the furthest away a group has been that I've had the privilege of connecting with to talk about mind, mood, and food. So I am going to share my screen and make sure that you can see my slides. Okay, can you see the slides and hear me? Are we good? Okay. And I do currently have a toddler who is going to bed. So if there's any background noise, please excuse that, but hopefully it will go smoothly. So as Brian said, I am Elizabeth Winings. I'm a psychiatric nurse practitioner, and I'm dual certified in that psychiatric mental health component across the lifespan, as well as lifestyle medicine through the American College of Lifestyle Medicine, which also has an international component. If any of you are also interested in that, I know that there's also the International Board of Lifestyle Medicine. And tonight I have the privilege of talking with you about what the connection is between our mind and our mood and the food that we consume. And so really what I would like to do, my hope, is that we can touch on some really important data that we currently have, also data that is developing and being investigated. Also, I want to do a refresher on the nervous system and its impact on overall health, because that's a really exciting area that really hasn't been studied substantially, because we can't study it in depth while people are alive. So most of our studies are postmortem. There are some good studies on living beings, but that's been a challenge. Then also I want to touch on this concept of learning theory and how this relates to food, because one of the most important things, regardless of if you are in healthcare and a healthcare provider or just a living human, the reality is that when we talk about food, we have to remember that eating food is a behavior. And so if we're asking people to change a behavior, we have to be conscientious about how they learn. And so we're going to do a brief touch on learning theory. And so before I dive in completely into this whole topic, I do have to confess that I never wanted to study mental health. I never wanted to work in mental health. I thought that I was going to become, I heard someone was an emergency room physician. I wanted to become an acute care nurse practitioner. I wanted to work in the emergency room and I wanted to do life-saving care. And what I found as a registered nurse, as I stepped into the American healthcare system, was that there were chronic diseases with repeated admissions and minimal improvements, very poor outcomes. And I had the privilege of working at our Veterans Affairs hospitals here in the United States, where we take care of veterans. And I had a series of patients that I was their nurse for amputations. So they were having a toe removed, then a foot, and then below the knee. And that was really startling to me as a 21-year-old. When do you stop cutting? I had a lot of questions for surgeons who didn't have time to talk to me, and they were very kind, but they were doing what they were trained to do and discharging patients as long as they didn't have an infection. They had their follow-up with physical therapy and sent them on their way with their, packet of what to eat to prevent further diabetic consequences. However, that didn't happen. And so that is where really for me, this love of behavior, how do we help someone make a change to save their life or limb, as well as food, began, was at the bedside as a nurse, seeing substantial consequences. And so I share that with you because I don't know where you are in your own personal journey with your lifestyle or what aspects of healthcare that you might be involved with, but I'm wondering if you could also be curious, where are there overlaps in mental health, physical health, and lifestyle medicine in your current world? Because the really cool thing about humans is there's not something that's magically dividing us. We're so intricately woven, our physical and mental selves. So let's dive into some of the data. We're going to talk about genetics and mental health. And one of the most important things to keep in mind is that all of our historical data is limited to the constructs of male and female gender. And so we have to be mindful that's not going to capture the entire spectrum of a gender experience. And gender is a social construct. So it really does matter what somebody identifies as if we're going to start to categorize that into data. And so for the sake of this lecture, we are going to be talking about traditional data, and that has been collected under those two constructs of male and female gender, because that's what we have. And the other thing to be mindful of is in the United States, as well as globally, when we talk about mental health, we have two ways of categorizing it. So we have the DSM-5, which is our Diagnostic Statistics Manual on mental health, and we use that in America for diagnosing mental illness. When we look at international data, we look at ICD-10 codes, or 11, depending on where you're at. And so that's what we're going to be looking at tonight, these categories of symptoms that then get qualified as an illness. So again, mental health is not something where I can take an X-ray or do an MRI and say, oh, based on these findings, you have major depressive disorder. We're going based on symptom clusters and symptomology over periods of time to meet these diagnostic categories. And when we look at these diagnostic categories, a lot of times there are specific behaviors that are either internalizing behaviors or externalizing behaviors. And the reason that matters is because internalizing behaviors are more common in the female gender. Externalizing behaviors are more common in the male gender. And so then we see that show up in the data. What we see is more women are suffering from depression, anxiety, and panic disorder. So they're internalizing their lived experiences, and it is manifesting as depressive episodes, panic attacks, or debilitating anxiety that feels like things are out of control, that can't be managed. It's the opposite when we look at the data for attention deficit hyperactivity disorder. We see that more so in the male gender. And so it's important that we're curious about this, because does this really mean that people are living with these mental illnesses, or does this mean that we are not meeting people early enough to equip them with ways to cope with their stressors, so that maybe we could prevent some of this future symptomology that would meet criteria? Now, one of the other things in data that has been underrepresented is the female gender. And so I do think it's really important that we take a minute to look at the woman experience, because women are suffering. And a lot of times women are the caregivers. Women are the ones who are going, taking care of everyone else. And then things fall apart, or they can't cope anymore. And so when we look at the data on how women feel specifically about themselves and their connection to their body and their relationship with food, the reality is most women are unhappy with the body that they live in. So they have a higher perception of body dissatisfaction. They also have this confusion about how should I feel? What should I look like? And there's this concept, we do have a lot of connection with social media and ways that we can maybe impact someone's lived experience. And there's this body positive movement, right? We don't want to be shaming anyone based on their body type or body size. However, the data doesn't show that that actually improves how someone feels. And it's important that we look at this number. 95% of self-perception, this data point is consistent for male and female genders, is consistent from adolescence through adulthood. And so what that means is, if we're going to be thinking, where do we have the opportunity for the highest level of impact and improving the quality of life, we really need to get curious about supporting that season of adolescence and equipping people to find things about themselves that are meaningful, and to nourish their bodies in ways that their bodies love them back. Okay, so this whole concept, the mind, mood, food connection, it's important that we ask the question, right? Is there a mind, mood, food connection? And if there is, does it matter? And the reason I say this is because when I wanted to study this in 2013, so over a decade ago, I was initially denied this as a topic for my doctoral research, because I was told that the relationship between the mind, mood, and food could only be correlative. It couldn't be causation, right? Like, if you eat this way, you'll feel this way. And there was a lot of pushback. And so I had to advocate heavily to continue to do this work. And I had to go to California. I live in Florida. So if you're not familiar with that, those are opposite sides of America. And had to go all the way to California to the True North Health Center. And thank goodness I got to do that and get connected with some really great pioneers in this area of science, and was able to go ahead and pursue this. And so some of the things that I've learned, and that I think it's also important to keep in mind, is that psychiatry as a medical science is also young. So not just this whole concept of lifestyle medicine and truly studying food and how it impacts our body, but psychiatry really was not treated as a medical science until the 1960s. If you look at the data, most communities would take individuals who are suffering from a mental illness and they would move them outside. They would put them in something called an asylum, or maybe there was a religious institution that would take care of them, but it wasn't necessarily considered an integrated model in a healthcare system. And so we don't have really robust long-term studies. Is there data over time? Sure. But we're really just getting to a place where we're starting to do randomized controlled trials, which are considered a gold standard of research. So when we look at this nervous system, it's really exciting because there's so many systems that are interacting with our nervous system. And we have this phenomenal brain that literally is woven together in the womb and is working from conception, all the way through our life. And there's this beautiful process that our body does called autophagy. And so this is where we're cleaning up the things that we don't need. We're getting rid of it and we're using it it's just gone. If we're not using it, we lose it. We hear that a lot with working out, with muscles. The same is true for patterns of behavior with our brain. And so what we see within the nervous system is that it is woven with the endocrine system and the immune system. There are actually new subspecialties of science called psychoendocrinology and psychoimmunology, where there is more research being done on what is the connection on someone living with a known endocrine illness and their mental health, or someone who has an autoimmune disease and their mental health. What happens when we start treating someone's immune diseases, and do they have positive mental health outcomes? What if we're treating mental illness? Do we see a change in the immune system function? So it's really important that we have more clear data on these things, because there's actually some theories that schizophrenia is an autoimmune disorder. That's not the point of this lecture, but if that triggers anything in your brain where you want to research that, the first time I heard it, I was like, that can't be true. But it's really fascinating because there are some individuals who respond really well to antiviral and or antibacterial treatment, and then their symptoms of schizophrenia go into remission. It's fascinating stuff. So we should be very curious about that as researchers and scientists. Within this brain and within this nervous system, we have our emotional responses. And this matters because there are all of these things that are happening on a day-to-day basis and a night-to-night basis. Sleep is driven by our nervous system. And we have emotions when we sleep. Emotions are the one neurobiological experience that we have zero control over. And some of these are autonomic. So that's without our conscious thought. So without effort, we can have a response. A lot of times when we think about an autonomic response, we think about reflexes. So if you touch something hot, you'll have a reflex to pull away. But we have these as well for hormones and for emotions. And then, of course, you can have conscious or on purpose thoughts and behaviors. You can't manufacture an emotion. So like if right now I was like, be sad, you might have a defense mechanism, but you're not just going to all of a sudden feel sad. There has to be something that uniquely triggers sadness within you, whether that's a thought, a memory, a song, a behavior. But you could choose to think something, to think a sad thought, or to think something funny. Doesn't necessarily mean that you're going to feel that corresponding behavior. So it's just very important. Giving you some brief working knowledge. Some of you might be in the psychiatric world, I'm not sure. But just to be mindful, because when we start talking to individuals about their relationship with food, they might have an autonomic response that is emotional and or defensive and or a trauma response. And we have to stay curious to that and patient and not just necessarily bulldoze through it. And so that's where we have responses over time that get embedded and they create emotional patterns and behavioral patterns. And sometimes in my work with patients, there's a lot of guilt and shame around that, where there's this sense of, I don't know why I choose this, or I don't know why I'm eating this way. I don't know why I can't choose what I want to choose. And we need to meet people there with compassion. You actually have a feedback loop in your brain that's making it hard. So maybe we need to work on that before we really spend so much time over here on the outcome. We have to trace it back to what's causing the difficulty here. So where do feelings come from? They're a neurobiological response to life. It is literally a generated experience from our nervous system. And it is complex. It is coming from all of our senses. And so you have 5 senses: sight, sound, taste, touch, and hearing, all of which are active right now, I'm assuming. If I were to encourage you to pay attention to how you feel seated in your chair, you might shift your position. You might notice that your mouth is dry, or maybe you're eating and something tastes yummy. Hopefully you can hear my voice. And that you can see something meaningful to you while you're listening to this lecture. Maybe it's my slides, maybe it's something else, right? So your nervous system is processing all of this at the same time, and it's creating your internal experience of the external world. All of this experience is happening through neuronal impulses. So our neurons are doing this right now. And this is an electrical communication system. When I first had to teach neuro anatomy and neurobiology to my nurse practitioner students, I was terrified because again, this field of science is truly something that is rapidly developing, and it wasn't something that was embedded in my curriculum when I went through my graduate programming. And so it's been really fun to learn, and it's given me this new appreciation for the validity of our emotional experience, because I think depending on how you were raised or the environment you grew up in, you might not have been validated that your emotional experiences matter. I'm not saying that that means we stop there, we just live in an emotional experience, but I am saying it matters. It's our nervous system taking our experiences and making meaning of them. So I'd like for you to go with me on a little bit of a trip. We're going to do a brief anatomy through some cartoons, so it's not going to get too heavy. But I want us to look at the brain, and then I want us to go zoom all the way in to that neuronal communication. So if we were to slice the brain transverse and look at the inside of our brain, I'd like to use my hand for this model. And if you place your thumb in the middle of your palm, and then you close your fingers over your thumb, this gives you one lobe of the brain. And you can do it with both hands, and you can create your own little brain right here. And we cross the brain lobes, or you cross your wrists, because your brain is contralateral. So what that means is the left side of your brain controls the right side of your body, and the right, the left. But when we look at the actual function of the brain, you have this really unique organ in the center called the amygdala. This is located within the temporal lobe of the brain, and it gets credit for being the center of fear and processing. What we're learning is it does a lot of other things too. It actually stores happy memories too. But the reason it gets credit for fear processing is because it takes those fearful experiences and stores memories in a way that's relatively permanent. So the data that we have right now says that if you have a very intense emotional experience that is connected with fear, it can be stored here in the amygdala. What that means is you will always be scanning for things in the environment that might sound like, taste like, feel like, seem like that fearful experience, because the amygdala is going to keep you alive at all costs. It will sound the alarm and say, this is not safe. We're in an unsafe place. We got to get out of here. That's great if you're actually in an unsafe environment and or need to get out or have an emergency response. The challenge is the amygdala doesn't have great sensitivity. So anything that is close enough to that memory or that fearful experience can send off this alarm. And this is a lot of times what is happening for individuals who are living with fear, panic, and or just a host of other things. So the amygdala gets credit for that. That could sound a little bit like a doom and gloom. Okay, well, what could we do about that? If it's relatively permanent and it's constantly scanning and working, how do we manage that type of system? Well, the cool thing is the frontal lobe comes online, depending on the data you look at, between ages of like 23 and 25. You start to develop full connectivity with the frontal lobe. And this is our emotional control center. And this is really where we see higher order thinking, critical thinking, and impulse control. And so when we think about developmental stages, this is where you see a lot of difficulty with self-regulation and emotional responses. I have a toddler. His amygdala works great. He communicates wonderfully when he's unhappy. He has tantrums and he has behaviors, and I know something is wrong. And so I am having to co-regulate with him because he doesn't have a fully functioning frontal lobe to help him weather that storm and get his brain back online. As individuals grow up, what we hope to see is less emotional responsive behaviors, less explosive behaviors, and more thoughtful behaviors. What this is called is a bottom-up communication or a top-down communication. And so when you're experiencing something or maybe someone who is having an emotionally driven response, their thinking brain is not online. So if we're trying to meet them where they're at, if we're trying to communicate with them, we have to speak to that emotional part of their brain. We have to help them feel safe. We have to help them feel seen and validated so that the thinking brain comes back online. Then we can engage with thought, with rational discussion, purpose, and intent. I think if there was a course taught on this to all people, we'll say high school, if we started learning this in high school as individuals, I think we'd have a lot better interactions with each other. I think healthcare would be different because I don't know what your instinct is, but my instinct a lot of times is to rationalize or to say, what's going on? How can we solve this problem? I like to solve problems. I'm pretty type A, but that's not going to work with somebody who's having an emotional response. An emotional response has to be validated first. And that doesn't mean some big warm and fuzzy response or something that is, going to totally derail you from the end goal. But sometimes you're taking notes or you remember anything there's two things you need to remember, and this is one of them. You say, I believe you. People, they're like, okay, I believe you is a beautiful statement to connect with someone and help them come closer to being online. So again, just be mindful if you're interacting and you're curious, is this person speaking to me out of their emotional brain or their thinking brain? That can help you know where to respond first. It can help you move through conversations in a more meaningful way. All of our neuronal communication, so all of this stuff that is happening is through neurotransmission. So the brain is an organ that is made up of bundles of neurons. Neurons make up almost half of the volume of the central nervous system. And here's where the food stuff starts to come in. So you're probably, if you aren't really interested in the nervous system or maybe psychiatry and psychology, this is where food comes in. Neurons cannot store nutrients. They have a very high rate of metabolism. They never stop working, which is kind of crazy to think about, that we literally have a body system that's created at some point, and then the neurons just keep working for us until one day we don't need them anymore. And so they can't store nutrients. What that means is we have to be consistently consuming nourishment to take good care of our neurons. We also need to be taking good care of the cells that are supporting and protecting the neurons. And some of those can store nutrients. We're not going to get into the minutia of that. But here is where we have to initially go. There must be a connection between how we eat, when we eat, and what we eat. If the neurons cannot hold their own nutrition, we have to be taking care of them consistently. And this is where the endocrine system is intricately woven. When we start to look at things like blood sugar drops, mood changes. That sounds like a really cool feedback loop, right? Blood sugar is getting too low. It's getting too low. I need you to eat. I don't like how this feels, right? And then we nourish our bodies and our nervous system's like, okay, we can make it another couple hours. So just that alone really is a cool concept of thinking that is a connected system. So the neurons are awesome, powerhouses. The way that they communicate with one another is called neurons. Sorry, the neurotransmitters are communicating between the neurons. Okay, so on this slide, what you're looking at, you've got the ends of two neurons, and then you have neurotransmitters that are going across what is called the synapse. And so neurotransmitters live in those yellow circles. And when those come to the wall of a neuron, they spill into the synaptic cleft. These are the chemical elements of that electrical communication. So we have to have a healthy electrical system and a healthy chemical system to have a healthy nervous system. We have over 100 known neurotransmitters in the human body. Current research and knowledge really only focuses on a few. And we're going to look at those in just a minute. When we start to look at what is a neurotransmitter and we break it down under a microscope, guess what they're made of? Amino acids. So then we go, oh, interesting. This is where food comes into play again, right? Because where are we going to be getting amino acids? Yes, our body can make some of them, but not all of them. So when we start to think about this chemical communication and having over 100, wouldn't it be cool if we knew what each of those were doing or what was the composition of that within our nervous system? But we don't have that data yet. What we currently know is based on 5 neurotransmitters: serotonin, dopamine, norepinephrine, GABA, and glutamate. Histamine is also studied, but histamine's kind of given credit to be a hormone and a neurotransmitter, so we're not going to include that for this conversation right here. Glutamate is what we currently know to be the most abundant within the nervous system. Of these 5 neurotransmitters, glutamate is currently the one that we really don't target from a psychopharmacology perspective. We're not really prescribing medication that interacts with glutamate. What I like to talk about here is you'll see that 4 of the 5 are listed in green. And the reason is those 4 require an essential amino acid. So when we talk about amino acids, yes, our body can make some, but when we start to hear this language of essential versus non-essential amino acid, when we hear essential, that means we have to consume that from what we eat. And so I actually think we should talk about neurotransmitters as essential or non-essential neurotransmitters. Not that any of them are non-essential, but just saying we cannot equip our body to have the serotonin we need if we are not consuming the precursors. Same goes for dopamine, norepinephrine, which is a substrate of dopamine, and glutamate. I am not against pharmacology. I prescribe medicine. It is meaningful. I've seen it change lives. I think that it is a tool that we have within our toolkit to really support people who are working on symptoms of mental illness. When we look at data, and this is from the United States, it's about 13 to 17% of adults are using an antidepressant in the past 30 days. And this percentage goes up to 19% when we get to age 60 and older. So our older populations are suffering from more symptoms that are requiring antidepressant treatment than maybe younger generations. And there's more and more data on the prescription of medication. But the reason I say this is because, yes, prescribing medication might have a positive outcome. But if individuals are not consuming the food that they need for their body to make the neurotransmitters that are going to be working in their nervous system, right, completing that electrical chemical communication, all the medicine is going to do is manipulate what is there. So when we think about an antidepressant, let's take serotonin, a selective serotonin reuptake inhibitor. All that is doing is interacting on these receptors. It's either blocking some receptors or not, and manipulating what serotonin gets reuptake, taken back in to be used again, or not. It's not manipulating new production of serotonin. And so I think that's a really important thing to be mindful of when we're talking about the utility of the tools that we have. Use it. If it's working, great. But also, I think we have an ethical responsibility as healthcare providers to tell patients when you're consuming the essential amino acids that make your serotonin, you might be setting yourself up for better outcomes. We're going to look at that. That's the data that we need. That's the funding that we need to do studies like that, where we can really do comparative studies, right? Where we're saying different dietary interventions. We don't have that, but I'm going to get to that, what data we do have. So here's where we need to talk about self-image. Okay, if 95% of our view of self or our perceived experience is created in adolescence and relatively consistent through adulthood, what is that? Well, it's your personal view. It's the conversation you have with yourself, how you interpret your experience in the world. And for some individuals, they have a really healthy view of themselves. They might have a little bit of positive, negative, and neutral going on. They might have some of these words on the slide, right? They might be kind to themselves and say, I'm really smart, or I'm creative and I'm kind. Or there might be a lot of negative stuff in there, like I'm ugly, I'm annoying, or I'm outspoken. This is stuff that really matters, because when we're talking about that amygdala and the emotional responses, or things that can trigger bottom-up communication, this is a learned pattern of thinking that can get attached to our behaviors. And there's a few different ways that individuals can conceptualize this. The real self, which is how we show up in the world, how people experience us. It's normal to have a little bit of both, positive and negative. Maybe some neutral is in there. And then the ideal self. The reason I talk about this is because it is okay and healthy to be striving for improvement, to have this ideal version of oneself. But it's actually not healthy if that is something that is causing a lot of negative feedback for yourself, or guilt or shame. Or if someone is pursuing a lifestyle change, if the ideal self, is an exclusive whole food, plant-based nutrition eater and lifestyle and marathon runner and all the things, and, somebody makes a decision that feels out of alignment with that. To have grace and compassion and kindness to themselves, to know that's okay. That could be the real self, and we keep working towards the ideal self. We don't have to beat ourselves up over it. Where does this come from? It's influenced from birth. Another area that I love, attachment theory. If anybody is interested in that, it's really fascinating. But it's influenced by our thoughts and experiences, our messages that we receive culturally and socially. That starts at home in a family system, and then wherever somebody goes outside of that. Feedback from others, whether that's intentional or unintentional. So direct feedback or indirect feedback. Social media, the data on that is very compelling. It's not great for self-image. And if you remember at the beginning of the lecture, we were talking about the body positive movement on social media. That doesn't seem to actually improve somebody's self-image if they're engaged with that. So it's an interesting thing to be conscientious of. And then internal dialogue. So this entire list, we don't actually have control over a lot of it, but what we do have control over is internal dialogue. And this is a really great place to start at any age, but especially with adults. Self-talk matters. So the way that we talk to ourselves and think matters. What you think matters, what you say matters, you matter. And Dr. Clapper is someone I had the privilege of training under at True North Health, and I continue to collaborate with him in a variety of ways. And he has this saying that he always says, that your body is never not looking, when he's talking about the food that we're choosing to put in our body. Our body's never not looking. Like, didn't see that Reese's peanut butter cup over there, right? Like, it knows what's coming in and out. And I like to say your brain is never not listening. And so I think that's really important working knowledge, because for individuals who may have ways of thinking and living that they did not choose, they don't have to keep them. They can be in that thinking mind and choose something else. For some individuals, this sounds a little cliche or maybe like cheesy. Like, okay, come on, it's not that easy. You can't just change how you think. And it might not be that easy. But the reality is, the more that you practice, the easier it becomes and the more authentic it becomes. And so we're going to practice. I'm going to give you some phrases to trade. And these may be phrases that you yourself have said or might say, or maybe they're phrases that patients say. And it's really important when we're talking about lifestyle that we choose language that supports living and that supports healthy decisions. And so, again, this is a very short list. And so this is not all encompassing. And this is stuff that I came up with. So it may not resonate with you, and that's okay. But to find phrases that do resonate with you, that's what's really important. And so a really common phrase that I hear from adults and children alike is, I'm fat. That's not kind. Even if you have an amount of body that is taking up space, that's not ideal, maybe not healthy, you deserve to take up space. You could say something like, I'd like to feel more comfortable in my body, or I deserve to take up space. So we're not going to dismiss and live in an unhealthy pattern, but we want to be mindful that we can communicate with ourselves in a more compassionate way. I'm ugly, something else that I hear from people, or the challenge of just being dissatisfied with the way they look. No one was born into a body they chose. We didn't get to, select something and then it came out. And so it's okay if there's something about yourself that maybe isn't your favorite, but it's important to be mindful that our bodies are constantly changing. We are not going to look the same in a year as we do now, 5 years, 10 years. And it's important not to tie our worth to our look and or the shape that we are or the space that we take up in the world. And so I like the concept of reflecting on my worth is not defined by how I look. Each stage of my life has meaning and value. And then one of the phrases that I constantly practice trading is I'm difficult, because I can be strong-willed and have ideas that I feel like are meaningful and maybe I want to work on, but maybe it's not the right time. I have preferences is a way to be kinder to myself than to just reflect on maybe I'm difficult. What's important is that we break up with the phrases that are no longer serving us. And so this can come to the way that we think about ourselves, the way we look, the way we think, the way we show up in the world. But it's also really, really important when we talk about food. And so these are phrases that you might have said or heard, but they matter. So individuals, I hear this all the time. Oh, I can't eat that. Well, actually you could. You can actually eat anything you want, right? It's your choice what you put in your body or you don't. And so a more thoughtful statement might be, I'd like to choose something else to eat right now. Also, that's unhealthy. Yes, we could talk about the chemical makeup of food and what it's going to do in our body and whether it's going to promote health or not. But it's not necessarily a kind way to speak to ourselves around food. And so saying something like that's not in alignment with my health goals, or that's not going to get me closer to a healthy X, Y, or Z, whatever's important. And also, I always mess things up. Oh, I hear this all the time from patients where they're saying, I can't do this. I always mess up. I always get the bag of chips at the gas station, or, oh, I always am eating ice cream and chocolate or whatever. Just my sweet tooth, it's just so strong. And to step back and say, sometimes I make mistakes. Yeah, sometimes I choose something that's not in alignment with my health goals. That's okay. I can try again. Because perfection is not the goal, right? When we're talking about the ideal self, we're never actually going to get there. If you meet someone who does, save my contact information and please reach out. Because the reality is, no one is truly living in this perfected, authentic version of themselves. We're all continuously working towards it. And so wherever you find the opportunity, maybe to reflect for yourself or to get more curious as you're listening to the language of patients, you might find little moments where you can give this to someone, and it could introduce the sense of compassion for them with their relationship with food. All right, so what does the data say on mood and food? So if you're here, you're interested in eating a whole food plant-based diet. I like to use the word lifestyle more often than diet, because the root word of diet is die, and the root word of lifestyle is life. And so I think it's important that what we say is reflective of what we're doing, right? We're talking about living a healthy lifestyle. And so when we go to the data, what we see is consuming fruits and vegetables are associated with lower rates of depression, and specifically fruit. Fruit holds a protective factor for preventative effects on depression, even if individuals are unemployed. That's fascinating to me. We see that consuming fast food, so if the amount of fast food that you're consuming or processed food is outweighing the amount of whole foods, then you have an increased rate of depression. So then we have to kind of think, okay, well, then where do we focus our energy, on avoiding fast food or on increasing whole foods? And the reality is that if you spend more time consuming real food, so fruits, vegetables, whole grains, legumes, that is actually more protective for mental health than obsessing over every single time you might eat something that is processed. And so that's really important to be mindful of, for people to put their energy on just increasing the whole foods that they're consuming versus micromanaging the times that maybe they're in a rush and they make a choice that's not in alignment with their goals. When we go to the data and we say, these amino acids, these precursors for neurotransmitters, where are they? What's very exciting is that they are found in plant-based foods. And so I don't want to become reductionistic. And I used to show a slide that showed, avocados have the precursors for dopamine, which is not surprising. Avocados are delicious. Also, the cacao bean or chocolate is also on there, and coffee. But what the important thing to take away is it's a symphony of plant-based foods that we eat that gives our body the ability to make our neurotransmitters, serotonin, dopamine, norepinephrine specifically, have been correlated. And then also we do see GABA and glutamate. One of the things that is super important to be mindful of when we talk about GABA and glutamate, GABA is actually the neurotransmitter that helps us feel more calm. And so if we're saying most of the world is a little stressed, the COVID pandemic did not help with that. Anxiety was at an all-time high. And so if we're talking about ways to really increase our body's ability to create and use GABA, we 100% should be focusing on increasing whole foods. Fruits and vegetables are a great place to start. When we look at the consumption of soda and water, I think this is so compelling. And I work primarily with adolescents in my outpatient practice. And this is where we start on consuming more water, because what we have seen is over time, and actually it's a 15-year study, and this was international, and it showed that individuals consuming more soda over time, and this is just two to six drinks in a week. So you're talking 2 to 6 sodas or soft drinks in 1 week period, were at a higher rate of having depression than those who had 1 or less per week. And that to me is pretty substantial, because most individuals who are consuming soda or soft drinks are having more than 2 a week. And so if we're looking where we can make a huge impact, if we could say, that should really be rare and on a special occasion and not your foundation of how you're hydrating your body, you're going to also increase somebody's likelihood to have protective factors for mental illness if what they choose is water. And in Australians, ages 16 and older, those who consumed more than 16 ounces per day of soda had an 80% greater risk of depression. Just that data alone. And this was over time. So, that to me is so compelling, to just say, let's nourish our body with water. And if you're going to have something carbonated, choose something maybe like carbonated water. Okay, so how do we apply all this? How do we help people go from cool facts to I'm going to integrate this into my lifestyle. I think this model is a great place to start. And again, I'm a nurse. I'm trained as a nurse. I'm a nurse practitioner. And this is actually Patricia Brenner's model of clinical competence. And so what this is proposing is saying that you go from being a novice or somebody who has unconscious incompetency. You don't know what you're supposed to do and you don't know how to do it, all the way to unconscious competency. You don't have to think about it and you know how to do it. You're an expert. How do we move through these stages? So this idea of going from a novice to an expert, if we're going to talk about applying this concept of, I want to support my nervous system. I believe there's a mind, mood, food connection. I want to eat a whole food, plant-based diet. Remember, I'm just making a jump from clinical competency to a health behavior, but I think it's applicable here because here's what the data says, that to go from being a novice to an expert, we're looking at 2 to 5 years. We're saying, you know what, you're not going to get to competency or proficiency until you've been truly putting effort, conscious effort towards these behaviors and patterns for 2 to 5 years, where you can really see things as a whole, come up with long-term solutions. And then you're going to move into this concept of being an expert, where maybe you're flexible, efficient, you have some intuition, you can take on new things. And so I think it's really important that we hold this in mind and that we have compassion for individuals who are saying, yeah, I want to change my lifestyle. You know what? You might make some really profound changes in a short amount of time. But to sustain that, we have to have realistic expectations. You're not just going to overhaul your entire life and sustain that for the rest of your life. I actually laughed last week. I had a friend who said, so you still eat plant-based? I was like, this is like an intricate part of my being at this point. And so it was interesting to me because that's really how some individuals approach this concept. It's another fad. It's another diet. It's another thing they might be willing to try. So to truly embody this lifestyle has to take intentional effort and belief over time. And it has to be integrated into somebody's self-knowledge, self-identity, and self-belief. And that takes rehearsal, repetition, structure. So if we are facilitating that change for individuals, being patient. All right, so we're going to wrap up with this. The evidence exists. I don't want to take you through, an entire meta-analysis and all the things. The references are on my slides if you are interested in those. I'm happy to send them your way. But for mental health, we know that fruits and vegetables are protective against anxiety and depressive symptoms. So we should eat them. We should eat a lot of them. I don't care which ones. Eat the ones that taste good to you. Eat a lot of color. Nutritional differences impact the way that your brain will age. So a global study that tracked individuals in utero all the way through geriatric, it was compiled data over 15 years they were reflecting, suggested that the increase in fruit and vegetable consumption was protective for the brain over time. And so we can't hear that and ignore it. It's really important to be mindful that that's meaningful data. And it was consistent across the lifespan. And so we could get into the minutia and really say, when should we put the most effort into eating whole food plant-based? But I think that's frivolous when we could just say, hey, if all humans put a little bit more effort into eating fruits and vegetables, we might see an improvement in how individuals were feeling. And I kind of laugh about that because I'm like, I get paid to talk about eating fruits and vegetables. But that's where we are, right? Because we have so many food-like products in the world, and it is actually really hard for individuals to choose fruits and vegetables because all of this other stuff has been manufactured to smell good and taste good. And so it tricks our brain and it causes dopaminergic responses where we go, I want more of that. So it takes time to recalibrate and get back to where we're like, wait, fruit and vegetables are delicious. How should our meals look? Meals should look like this, the bowl on the left, not that. We don't want restriction. We don't want to get into calorie counting. I think that's another slippery slope in healthcare where we start to say, count your calories. Please don't say that, because we didn't know what's in that calorie, and it doesn't actually help people to focus on it. So if we just say, make your food colorful, pick things that are real, that came out of the ground, off the tree. That's more helpful instruction. Meals should have variety. They should be diverse. That's going to support our gut microbiome. It's going to support our body's ability to grab what we need to make our neurotransmitters. There's so many ways to create, plentiful lifestyle when we're consuming plant-based diet. Meals should be shared. And so that's something else when we start to talk about mental health. Doing life with others is really important. We are not supposed to live in isolation as humans. We're supposed to live in community and have shared behaviors. And so I think it's really beautiful that we got invited to be a part of your community and to spend some time with you. The other thing to be mindful of, when we look at the symptomology of mental illness, repetitive behaviors in isolation actually start to get symptomatic of disordered eating. And so we want to stay away from that. We want to choose shared behaviors. Okay. This is a quote I like to give because I think it's really meaningful. If you have to sacrifice your voice to keep the peace, it is no longer peaceful. You are internalizing the chaos instead. And this is a quote from an Australian psychologist. And so this is someone who really has spent a lot of their career on this concept of self-image and self-love. And so when I think about our brain is never not listening, then we need to be making sure that the conversation we're having with ourselves is kind and facilitating a peaceful experience so that we can show up in our relationships with others. Okay. We talked about a lot, but this is my summary slide. Where should you focus your energy? On things that feel authentic and joyful to you. That is going to set you up for a better mental experience. Also, get some sunshine. You can't make vitamin D without it. That's a huge, important hormone vitamin that we need. Eat fruit, eat veggies. Reflect on your inner dialogue. Some people are really good at that. They enjoy thinking and being in their own mind. They might enjoy journaling. Some people don't. And so we really have to challenge them to get curious about, wait, do I talk to myself? What are the thoughts that I have? And then spend time with people that you love and feel loved by. And don't always assume that that's family. And I say that with love. So I hope that you all have meaningful relationships with family, but some people don't. And so it's important that we meet our clients where they're at, we meet ourselves where they're at, and we put ourselves in social environments that are meaningful to us. So I am truly grateful for the opportunity to chat with you all tonight. I'm happy to take questions if there's time for that. Brian?
If you want to just unmute and ask a question, that's probably fine if anybody has a question.
I have a question, actually. How do we
Yes,
get more,
Jane.
how do we get more studies going?
So for example, and this is again in like 2013, 2014, when we had a pharmaceutical rep come to our office to talk about medical food grade omega-3 that they were wanting us to use for children to treat ADHD. And I asked them, well, what comparative studies have you done to food? And they said, oh, you can't get the omega-3 that you need from your diet. And I was like, then I went to my office and like Google and like printed out a list of omega-3s and the diet. And I just waited until their whole presentation was over. And I was like, hey, I just wanted to get your card before you leave, and I spoke to them privately, but I just handed it to them. And I was like, before you make a blanket statement that you can't get this from your diet, you can. And it's okay if you're not doing that research. And they're like, I'm just a rep. I don't really know.
I don't really know the
But-
science.
Yeah.
Look at
He's
the
like,
sprinklers.
do you want the coupon or not? But I was just like, for me at that time, I was shocked that that was kind of how things were put to the market, where it's just like the data says if you take this, you'll have a reduction in symptoms. But there was no data where they could say if you take this or eat more walnuts and mushrooms, you know what I'm saying? So there wasn't,
Yeah.
it wasn't great science in my opinion.
Other questions, anybody?
We'd love to hear those New Zealand accents.
I don't have a question specifically. That was fantastic. I really enjoyed that. Got a lot out of it. But there is an enormous amount of material there. I'm hoping we're going to be able to get a recording.
Many of you may not know this, but I work in a psychiatric hospital. That's my day job. I'm an outpatient counselor and therapist. And I got to tell you, a lot of the people I work with, I'd say 90% of them who are struggling with depression, anxiety, all kinds of different bipolar situations, schizophrenia. I mean, most of their diets are horrific. Now, that doesn't mean that that's the cause by any stretch of the imagination, but I often talk to them, and I have to be really careful because, again, I'm so biased about plant-based nutrition. But again, the data that's coming out now around, as Elizabeth mentioned, processed foods and its link to greater chances of depression, anxiety. It's really, really interesting. I mean, if there's one thing I could do, I'd probably just try to stop anybody from drinking soda. I feel like that
soda.
I think the ups and downs of soda, if you're drinking a lot of it, it's just devastating for your mood. But that's just anecdotal. I don't have any research.
Really, the difference is 2 to 6 in a week. I mean, I know people who will drink 2 to 4 in a meal.
Right.
Oh.
Exactly.
I was intrigued earlier on in your address, you talked about food making the brain work better, and the drugs that you can take only can work on the vitamins, I suppose, that are there already. Can you just explain that a little bit again?
Yeah. So I like to talk about SSRIs, or the selective serotonin reuptake inhibitors, because it's in the title there when we hear reuptake inhibitor. So what that tells us is the way that neuronal communication happens between a neuron, the neurotransmitter gets released into the synaptic cleft here. And that's where it is either used or gets reabsorbed by the next neurotransmitter. So medication manipulates the mechanical feature. So it's either going to block a receptor and prevent it from going forward, or it will reuptake into this one and it's used again. So neuronal communication is one directional. So that's where this reuptake is really an important feature of some of the drugs, because they allow there to be another cycle, if you will. They're recycling the same neurotransmitter. It's really fascinating when you start to look at things like methylphenidate and amphetamine products, because some of those actually have a double reuptake feature, which is where we see addictive properties, because they're so profoundly effective or actionable what they're doing within the neurotransmitter. Within the neuron to the neurotransmitter. And I just think that's a really important teaching tool for anyone to be mindful of that might be prescribing medication, because I also think it really empowers individuals to say, wait a second, the medicine's not like making more neurotransmitters for me. It's not like insulin. It's not like when you take it, you have more to use. The medicine is just manipulating what you already have. So that's really interesting to me. And I think it's empowering to individuals to make a choice. I am all for prescribing medication. I've seen it be so very life-changing. So I'm always cautious when I talk about this, because I don't want anyone that's had a benefit from medication to stop it. But I do want them to be mindful there could be even better outcomes if you eat a whole food plant-based diet.
I've watched a lot of Alan Goldhammer's videos and read bits and pieces that I'm actually contemplating doing a water fast soon. I'm currently doing a fasting mimicking diet a la Volta Longo. But you were talking about aminos and things and autophagy. I know during fasting, or pronounced autophagy, during fasting, our body, do the protocols at True North, do they supplement with aminos or vitamins or anything when somebody's doing a water fast?
So they do not. Now I was there in 2016, so I can't speak to current protocols, but at the time, no. We would medically supervise, wean individuals from a full whole food plant-based diet to water only if they medically were stable. And then you're monitoring them, and it was only water. If individuals started to become unstable, and what I mean by that is maybe their sodium was dropping or a different measure, we would reintroduce broth or watermelon juice, and then they could go back on their fast if that was their goal, or they could be walked back towards whole foods. But no, there were no supplements. It was only food or water or juice that was made in the kitchen from watermelon or another fruit.
Okay, thanks for that. Appreciate that.
Yeah. But the really cool mechanism of fasting, again, off topic, but if any of you are interested in this, the ability to tell the difference between cancer cells and real our own cells becomes more profound because it allows your cells to go into a protective state. And so then when the chemo comes in, it's going to go after the cancer cells. It still might impact your authentic cells, but there actually are more and more studies. There is actually more research done in this area that shows that it's a protective factor, like an immunologic protective factor if you fast prior to chemotherapy.
You raised a really interesting point. If you don't mind, I'll comment on something that is so complex. And Dr. Esselstyn often talks about the importance of eating greens and chewing them in your mouth, because the bacteria in your mouth begins the process of turning them into nitrites. And so I think sometimes that urge to find like the one key ingredient or two ingredients that we can pull out of vegetables and then turn into some sort of elixir is a really interesting one. It's just kind of human nature. But, I think I tend to sort of tell people, like, we can't even begin to understand even Dr. Winings, you were talking tonight about how the intricate interplay of everything that's going on in the body to create these important neurotransmitters and all that stuff. And so I tend to be skeptical generally of this notion that we're going to isolate something, or we're now going to, find a smoothie that changes everything. I think, again, it's about eating the rainbow and eating all these different types of phytonutrients and antioxidants and actually putting them in your mouth and chewing them and all that stuff. So anyway, that's my little plug for this idea of yes, I believe that science is going to deliver really amazing stuff in the next 20 years or so, but I am still back to, I'm a little old fashioned in the sense that if we just get it in our mouths and chew it and eat the right stuff, it's probably a lot better.
Mm-hmm. Yeah, and that was where I've been given feedback by a friend and colleague, David Goldman, who's like, I think your slides are too reductionistic. People are going to walk away from your talk and think if they eat avocado, they're going to, fix their mental health. And I was like, well, what if they're not eating avocados? But, he's right. And it's so compelling. And I was so excited when I finally saw research that was like, look, here's this, chemical compound for dopamine, and here's all the things that we found this in. And I was like, this is the answer, eat bananas, eat avocado, right? But really, the conclusion of that article is not eat one thing. It was eat all of the things that you like, whole foods, consistently, change it up over time. Well, thank you for giving of your time and having me and turning on your thinking brains.
Thank you so much, Dr. Elizabeth.
Yeah, we'll be back in a
Really.
couple months with oats, flats, and bowls, right? I think that's our next presentation.
See you guys soon. Bye-bye. Thanks,
Great
Elizabeth.
to meet you all. Thank you.
Thank you. See ya.